Hi everyone, I hope you are all doing well. My name is Hannah. I am a student at McMaster and I'm also a volunteer at Dr. Kearney's clinic. Today I'm just going to be going over a PowerPoint that kind of goes through ways in which we can manage anxiety, why it's important to consider this during this time, and how we can stay mindful during COVID-19. Albeit it has been a couple months since we've had social distancing put in place pretty much everywhere. But I think that the tips and suggestions that I make in this presentation are just as pertinent and relevant as it was 3 months ago, if not more, just considering how things are so quickly changing in the world. And I'm hoping that with this presentation, all of you who are watching, you get inspired, you get reminded of perhaps ways in which you can take care of your well-being, stay healthy, both emotionally and physically. So yeah, I'm just going to get started and I hope you enjoy the presentation. So this is just a table of contents that I've made that kind of sums up the presentation. So the first topic is going to be mental health and COVID-19. So how has the pandemic changed our lives on a mental health level? And then I'll be talking about mindfulness and how we can practice mindfulness right now at home, at work, and just how that's going to help us focus on the present and help us to kind of cope with the pandemic. And then finally, how we can cope during a time of uncertainty. I'll just be talking about a couple suggestions I have for all of you that I think you will probably all and hopefully be practicing for the last couple months. But I think it's always nice to have a reminder of what you could be doing and what might be helping with your emotional and physical well-being and what might not. So I'm just going to dive right into it. So the first topic, like I said, will be about mental health and COVID-19. And to start off this section, I actually wanted to bring up a study that I was reading about a couple months before, but they've actually published a summary report of their findings, which is in the next slide. So this study was done by the Mental Health Research Council. They surveyed people across Canada and totaled to around 1,800 Canadians. And based on that, one of the key findings they found there was that Canadians reporting high anxiety levels have quadrupled, and those with high depression levels have doubled. And so obviously by the quadrupled and doubled, it obviously signifies that there has been a dramatic increase in both anxiety and depression across Canada in several provinces as a result of the pandemic. If you want to find the summary report and look at the findings yourself, you can definitely do that. Just type in mhrc.ca and you'll be able to find on the front page a link to the Mental Health and Crisis, how COVID-19 is impacting Canadian study. And obviously we have to be cautious with the sample size that they were able to achieve. It's obviously not entirely representative of the population here in Canada, but I do think it does signify that there is a clearly an impact that the pandemic has been having on mental health. I also want to mention that the CDC has also stated that there are certain populations who may have a stronger stress response to a crisis such as a pandemic. So that includes individuals with chronic illness that puts them at higher risk for contracting the virus, experiencing complications as a result of having the virus, children and teens, those working at the front lines, so first responders, healthcare providers, grocery workers, or anyone who is currently working as an essential worker, and people with mental health conditions that include substance abuse. So I think it's just important for all of us to recognize that we are all susceptible to experiencing anxiety and just other negative emotions as a result of the pandemic. And I think that's all the more reason to continue to take care of one another and just reach out to one another and make sure that we are all doing well. I think the summary report of the study that I just mentioned also touches upon potential reasons that people get most anxious, but I just wanted to talk about potential things that may be causing worries, causing anxiety and stress. So you or those that you love may contract the virus, you're worried about receiving medical care if needed, feeling socially isolated as a result of staying at home, job employment, and I guess the future of what that's going to look like, finances, so taking care of the household, taking care of your family, and life after the pandemic as well. And what I really want to stress here is that it's okay to feel those feelings, to feel worried or distressed about any of the reasons I mentioned or any other reason as well. These feelings are normal in the face of an unexpected crisis such as the pandemic. I don't think any of us knew 6 months ago that this was going to be what life would look like in 2020. So I think it's definitely good to acknowledge the fact that you're feeling those feelings, but also knowing that you're not alone and that so many of us are experiencing similar feelings, similar reactions as a result of the pandemic. So kind of related to that, I want to talk about how we can use mindfulness during this time, whether you're at home, whether you're working, and how that can help us kind of cope. So what is mindfulness? I'm just going to go through a brief definition of what it is for those of you who might not be as familiar with it. So mindfulness is a state of being present. It's being aware of our thoughts, our feelings, bodily sensations, and environment, and just accepting them for what they are instead of judging them. And I think that's the most important part, is that you're acknowledging how you're feeling and what you're feeling, and you're just accepting them as they are without judging them, negative, positive. You're just allowing it, or allowing yourself to feel. And what I think a lot of people have is this misconception that you have to meditate in order to be mindful. You have to be like sitting cross-legged and kind of like taking 10 minutes or good chunk out of your day in order to practice mindfulness, and that's not it at all. Mindfulness is not the same thing as meditation. If you find mindfulness meditation works for you, that's great, but I also know some people aren't into that. So you can definitely practice mindfulness without the meditation, and it can be just as effective. So how can we practice mindfulness? I really like this graphic on the left here because it describes it as stealth mindfulness. And it says here that even if you are on the move all day, there are still plenty of opportunities to practice mindfulness. And I think that really highlights the fact that you don't have to be sitting still or focus on your breathing for a long period of time for you to say that you are being mindful and that you're practicing mindfulness. In fact, the fact that you can maintain mindfulness throughout the day, I think, is much more important than that. Just because it's hard to focus on what you're doing sometimes. I think especially during this time when there's a lot of anxiety and stress that's present, at least I feel it. I find that being mindful is really helpful because it kind of prevents me from taking my anxiety to the next level and instead focus on the things that make me happy, focus on the things that I need to accomplish for the day. So that includes things like when I'm eating, I'm focusing on how the food is making me feel. When I'm taking a walk in the neighborhood with my family, focusing on the experience and the emotions that I feel as a result of making that decision to take a walk outside. And really just focusing on the present and staying aware, I think, is the most important part of practicing mindfulness. So in here, I kind of wrote that we can practice mindfulness by doing active listening, connecting with your senses, pausing between actions and kind of reassessing how that made you feel, and observing your thoughts and emotions, and perhaps pondering why you feel the way you do in between as well, and just really focusing on yourself, so looking within. So this is something that I really want to talk about. I think it's especially relevant for those of you who may be staying at home consistently, just like I am. I rarely go out unless it's for exercise, and I find that it's so important to consider how we're eating at home, especially for those of us who are staying at home. I find that the temptation to snack on things in between meals can be really big, and that may lead us to make unhealthy choices rather than healthy ones. So in this graphic on the left here, it kind of talks about the difference between mindless eating and mindful eating. And one of the signs that you can tell whether you are being mindful while you're eating is just listening to your body and taking the time to eat and focusing on just eating. So not doing anything else while you're eating, not multitasking, but just focusing on what you're eating and how that makes you feel, and the quality of food that you're eating. Is it healthy? Is it unhealthy? And kind of really considering that. And I think for me, because I have so much time at home, I actually think that works to my advantage because I really do consider what I'm eating and how I can eat healthier by staying at home and having the time to really think about it compared to when I'd be attending school. So definitely in that, I think that change of mindset for me has really helped kind of curb the cravings and focus on healthy snacks. And mindfulness has so many benefits. It helps your physical health, your mental health, and your relationships. It lowers blood pressure, it reduces chronic pain, it improves the quality of sleep that you may be experiencing, and it also enhances our immune response, which obviously is all the more important during this difficult time. I think we all want to be reassured and make sure that we're maximizing our immune response as best as we can. It also helps mental health. It reduces anxiety, stress, while enhancing working memory and emotion regulation. And emotion regulation especially, I think, is so important for relationships. At least for myself, I find that being at home, I've been at home with my family, so my parents and my sister, for the last couple months, and I find that it's definitely more difficult to stay at home with several people for a really long time without having the option to leave the house often. So emotion regulation is definitely important. And by improving your emotion regulation, it improves your relationship quality for everyone, really. So I think that everyone would benefit from mindfulness, however you practice it and however much you practice it. So this is just an extension of mindfulness rather than a part of it, but I still thought it was really important to touch upon why thinking positively makes a difference and why it's important, especially for the circumstances that we're living in right now. I think if you can look on the left side here with the graphic, it's the glass that's either half empty or half full, and usually it's a comparison between optimism and pessimism. And I think we often all believe that the way we perceive a situation or we perceive an event is how things really are. So I guess in the moment we feel the intensity of the emotions, and it's hard to consider other people's perspectives. But in hindsight, we realize that our perceptions of all the experiences we have in life are biased because we come with our own belief systems, we come with our own thoughts, our own emotions, our own past experiences, and our perspective, which differs from everyone else that you will meet in your life. And I think especially right now, it's really important to show compassion for other people, even though we are all having a hard time ourselves. I think really coming together and just making sure that you're considering others, and really taking into account how the way you might be feeling is also how someone else might be feeling. So part of that is in reframing or changing the way that we perceive events and situations. I think this happened a lot initially in the pandemic, but I think a lot of blaming was going on in the beginning of the pandemic. But as more time passed on, I see so many of the great things that our community is doing for those who are in need of support. And I really think that's a great example of showing how just community support and how being able to show compassion for other people can make such a big difference. So I really encourage you to try reframing. And I think this applies in general. It can apply to the people that you're living with right now. So if you're living with family, I myself know that it can be very difficult to stay or to see the same people every single day for all hours of the day. So definitely being able to reframe, being able to show empathy and compassion, I think that's really important, especially when you're kind of stuck at home with the same people. So there's so many different situations in which we can practice reframing, and it has so many benefits for both yourself and just the way that you're feeling. I think reframing is just so important for all of us to remember to do, even during a time that we are having difficulties ourselves. So finally, we've reached the last category or topic, which is how we can cope during a time of uncertainty. So the first suggestion that I have for you is to limit media exposure related to COVID-19. And while that might sound a bit counterintuitive to what you typically hear, which is to stay informed, stay updated, I think in general, media has the ability to sensationalize things that are going on in the world. So they have the ability to over-exaggerate or create these jarring headlines that make people really anxious, really stressed, and really uneasy. So I think in that way, overexposure is definitely not good. So for those of you who are more anxiety prone, I would recommend minimizing the time that you read or watch the news to half an hour to an hour even. Really trying to minimize how much time you spend kind of looking through or scrolling through the news, so that you're able to carry on with your day without always having to rely on an update that's going on about what's going on in the world. And the most important part here is that especially you should be choosing trusted resources to stay informed about the pandemic. So not just looking at a news website, but looking at websites such as the CDC, such as the World Health Organization. So looking at sites that are verified and accepted resources for you to stay informed about what's going on. So kind of in relation to this, I really encourage those of you who are more anxiety prone to restrict the amount of time that you dedicate to worrying about COVID-19. I think it's very easy to continuously worry about anything really, but especially with the pandemic and especially with all the news and the information that is being put out, I would really recommend taking a time out of the day to really let yourself feel all the emotions, all the negative emotions that you're feeling, and consider why you're feeling them, the extent to which you feel them, where is it coming from, and saying that out loud, talking about it with someone that you trust, writing it down even, and I think that would really help you to carry on with your day without feeling like you have to repress those emotions. We all feel those emotions at some point. I think there are certain times in a day or within a week at which we feel most down. So definitely don't feel like you have to kind of be your best at all times, and allow yourself to have time where you can feel anxious and feel stressed. But as I said, kind of designating that time and then allowing the rest of your day to keep yourself occupied without the use of electronics or constant updates if you can. So I've put a couple pictures here, but that can include baking or cooking. I think that's been a really popular activity that people are doing while at home. Exercising, there's so many home workout videos I've seen on YouTube that are all amazing. So I really recommend you try one out if you can. And I think with the weather warming up too, for those of you who are interested in gardening, I think that's also another way of getting in good exercise and a breath of fresh air. So I really recommend you kind of choose a hobby or some kind of activity that will keep you going while at home. And the second one, I'm sure all of you have been practicing on your own, but that is to check in and stay connected with others. I really think this is so important. These suggestions are not in order. They're all just as important as the other or the one before, but definitely try to stay connected with those that you love and those that you care about. It can be through calling, through texting, or emailing. I love that we have so many online platforms that you can use to have a group calls. So I think Zoom has been really popular these days. Skype, FaceTime, Facebook, WhatsApp, there are so many different apps that can be used to contact your loved ones. And what's really important to remember here is I really encourage you to check in with others often, because the person that you're contacting is really going to appreciate you having the thought and just a consideration to send out an email, send out a text, make a phone call. I think a lot of us didn't think much of it before the pandemic, but I think that means so much more, especially with all of us kind of having to be cautious and having to social distance from one another. And especially here, when you're talking to others, I really would encourage that you focus on the topics that make both of you happy. So talk about the shared hobbies that you have, or talk about the activities you've been doing, and just talk about positive topics or subjects that you will both benefit from through the conversation. So the next suggestion I have for you is to maintain a semi-structured routine or plan. I'm guilty of not following this as much as I would like to, but I've been trying to maintain a consistent routine for the last couple weeks. So I like to make plans for my day. So I like to wake up at a certain time, go to bed at a certain time. Same thing with my meals. If I can plan out my meals the day before, that's even better. It makes me feel like I have something to look forward to. Maybe planning out what I'm going to do during the day. So am I going to get some work done? How am I going to get my exercise in for tomorrow? Kind of thinking about those things and planning ahead. It makes me feel like every day is different rather than every day being the same. Because I think weekdays can seem like they're weekends. They all kind of just meld together. So I think having a plan and a routine that's consistent but also variable for you to do different things would be really helpful. So planning calls with friends and family, and have quiet time for yourself. If you're living with someone at home, I'd really recommend that you take time out of your day to just spend for yourself, do some kind of hobby that you enjoy, like playing an instrument, painting, drawing, knitting, gardening, anything that you can do on your own that makes you feel fulfilled and kind of happy. I think we all need some alone time as much as we enjoy social interaction, so I would really recommend that as well. The fourth suggestion that I have for you is to try to spend some time outside. I know this is very difficult right now with social distancing in place and just the constant worry of coming into contact with someone who may have the virus. But I would really recommend, if you have a nearby park or kind of trail that you can spend walking, jogging, just to get some exercise in for the day while maintaining distance between others. I think it would be amazing for both your physical and your mental health, and it may also reduce potential anxiety and stress you've been feeling by being cooped up in the house. I'm not going to go too much into the science of it, but when we do any type of exercise, and this includes like brisk walking, the body actually releases these chemicals called endorphins, and that's the reason why when we come back from a jog, or we've done some cardio or some yoga even, we actually feel really good after exercising. And I think what's really interesting about the chemicals is that they reduce pain perception, so they make us feel good and we feel pain less, and I think that's an added bonus, and all the more reason for you to have some time outside and get some exercise in, even if it's at home as well. And number 5, it's just to acknowledge that some days will be more difficult. I think this is such an important thing to keep in mind as you're living day to day. We're living in such unique circumstances. I really don't think I ever thought that something like this would happen in my lifetime. And I think a lot of us have been feeling that way about the year in general and how everything is kind of unfolding. And it's okay to feel those mixed emotions. I share in those emotions, the anxiety, the stress, the uncertainty. All of us are feeling some kind of mixed reaction in response to what's happening, and that is totally normal, totally okay. So do your best to focus on the positive and Focus on the present and focus on what you are able to do for yourself and for those around you, and how we can all help each other through these circumstances, and seek out support if you need it. There are so many organizations who are reaching out to those in need. If you ever need anything at all, please feel free to find organizations or just contact those that you love for assistance. I'm sure they're going to really appreciate you having the courage to ask them. And something I really wanted to add in here was a breathing technique, and this is called the 478 breathing technique. Some of you may know it, some of you may not. This is something that I like to practice once in a while when I'm feeling anxious or stressed. I really do think it works, at least for me, but I really recommend that you all try it out and see whether it works for you. So essentially, it's divided into 3 segments. The first part, you inhale for 4 seconds. And then you hold your breath for 7 seconds, and then you exhale through your mouth for 8 seconds at the end. And the most important part here, at least for me, is that the exhale is the longest segment out of the 3. It's almost like, I like to think of it as the exhale being the part at which I release everything that I'm feeling. And that's how I know that I want the exhale to be the longest, if that makes sense. But I really recommend that you try this out the next time you're feeling stressed or worried. I also recommend this for people who might be having difficulty sleeping at night. I did read that this has some benefits for those who are experiencing restlessness. So I do recommend this for that as well. And this is just something that I think everyone should always be reminded of, especially during these times. But I really do think that asking for help and support is a sign of strength and courage. It doesn't mean that you're weak, and I really recommend that if you are in need of support and help, to reach out to the organizations or reach out to hotlines if you need them during this difficult time. So this is the last topic I'll be talking about today with this presentation, but I thought it's really important to talk about the implications that isolation and staying at home, what kind of impact that has been having on individuals right now and also in the future. So right now with the pandemic, most of us are still staying at home. I think some businesses are still staying open, but many of us are protecting ourselves by staying at home, and that's elicited a lot of fear and anxiety and just concern over how long this is going to last, how long we're going to have to stay away from our friends and our family, and just in general, what's going to happen with this virus. What psychologists are worried about is what's going to happen once we resume our activities after the pandemic. They're calling this the echo pandemic. But when we say echo pandemic, we're not referring to physical health of Canadians across the country, but the mental health and the rise in anxiety and depression cases we're going to see as a result of going back to real life after the pandemic. And I think that's why it's so important for all of us to continue to take care of our mental health, our well-being, while at home, while at work, while we're going through this crisis right now, so that we're better prepared for what's going to come after and how we're going to cope then. But yeah, I really encourage all of you to continue to take care of yourselves. And just as a summary, stay informed, be mindful, reframe negative thoughts, stay active, stay connected, and take care of your well-being in whatever ways that means for you. Thank you so much for listening to this presentation. I hope it was helpful. I hope you feel inspired and encouraged to take care of your health in both physical, mental, emotional, spiritual terms. And the following are just some resources available online for you to cope with stress, anxiety, and depression and mental health related concerns. Thank you.